Hi, Tam here. So let's talk about cruise ship attire, cruise ship uniforms for doctors. So on the cruise lines I've worked for, as part of the uniform for doctors and nurses, you usually have between 5 and 6 types of uniforms. The most popular uniform is the officer's uniform, which is the white uniform with stripes. So that's number 1. Number 2, the second most popular uniform for doctors is the scrubs. Like the scrubs, the medical scrubs I'm wearing right now. And number 3 is the officer's uniform with a sweater. So it's a military sweater, a navy sweater, and that's quite popular as well, especially because the air conditioning sometimes can be a bit strong. So, you want to wear your sweater on top of your officer's uniform. So that's 3. 4 is the night uniform. That's a uniform that you usually wear after 5 p.m. Meaning if you're going to go into a guest area after 5 p.m., most cruise lines will say you're no longer supposed to be wearing your short sleeve white officer's uniform with your stripes, but you must go for a variation of that, and that's a long sleeve white officer's uniform with stripes, with epaulets. It's almost like a jacket. It's more dressed up, and it's something you wear after 5 on some cruise lines. So this simply means that if you work in the medical center and the clinic closes at 6 p.m, then after 6, when you leave and you want to go into a guest area, a restaurant or anything like that, you will change, go back to your cabin, change, and wear that uniform. It's very dressed up, and that's what you wear. It's your night uniform, basically. 5 is the elegant night uniform, or the formal night uniform. On a 7-day cruise, on your typical 7-day cruise, elegant night or formal night will be once or twice a week, depending on the captains. On some cruise lines, the same night uniform is going to be used on formal night. So your daily night uniform is what you are going to wear on your formal night. But on other cruise lines, you have a special elegant uniform for that one night a week where you're going to go and meet the guests. So, you meet the guests, you shake hands, you take pictures, and so some cruise lines will have something a bit different from your daily night uniform, and they bring in a tuxedo. So you're gonna wear a tuxedo, black pants, white shirt, if you're a bow tie, and that penguin suit up and there, you're looking like a maître d'. I personally never liked that uniform, but yeah, some cruise lines will do that. So for winter, when you're relocating into cold area, let's say you're gonna go into Alaska and you're gonna do some Alaska cruises for some few months, then you have a winter uniform, a thick jacket, a winter jacket with your epaulets and a winter hat as well, a beanie, with the logo of the cruise line, and yes, that's just. And you can wear this outside, but you can also wear it inside. So these are more or less the 6 types of uniforms that most cruise lines have, with some few variations depending on the cruise line. Now, when it comes to scrubs, of all these variations, my favorite uniform for me has always been the medical scrubs. It's very comfortable, and you're going to do some procedures. You're going to have to suture patients. You're going to have to put some casts, some back slabs, do all sorts of stuff, get on the floor. You're going to have to do some resus, when they call you for a code red. You have to run sometimes to a cabin when there's an emergency, and for me, the scrubs are ideal. If you get a bit of blood on your scrubs, it's almost expected. You've got some patients that are vomiting here. With some patients that have all sorts of things. It's nice to be in scrubs. Then you go back to your cabin there, you remove your scrubs, and you wear your own clothes. It's just more comfortable to be in scrubs. So it depends. Some doctors and some nurses love their scrubs, like myself. It's my favorite attire on cruise ships. Some doctors and nurses do not like scrubs and only wear the white officer's uniform. I've worked with some nurses and some doctors who have never worn medical scrubs. From the first minute they would embark on a ship to the day they would leave, months later, they would always be in the white officer's uniform. So it's a matter of choice. Personally, my reason for that, like I said, it's more comfortable, but also I've noticed that when you are interacting with the crew and the passengers as well, or when I'm interacting with the crew and the passengers and I'm wearing my white officer's uniform with my 4 stripes. Sometimes, not always, but sometimes some crew members and some passengers would be a little bit intimidated. And I would just say that the interaction would be much more formal. The conversation would be much stiffer. And if a crew member, for instance, would come and see me with an emotional problem, a sensitive issue, maybe some frustrations, maybe a bit of depression, like so many crew members have, a sensitive topic. The fact that I would be there with my officer's uniform and my 4 stripes and my epaulets, it would be difficult to break the ice and have the crew member confide in you and open up. And the same with the passengers. Sometimes some passengers will be a bit more formal and, it will just be a different interaction. I mean, a good interaction, but just a little bit different, because I guess the uniform creates that wall, that invisible wall, that distance between you and your patient. And all of a sudden, you're portrayed as part of management. A crew member has a problem with his or her manager and they are in distress, anxiety. They come to the medical center, they're crying. Because you're also wearing the uniform, you're part of management. You're part of, you're a 4-stripe officer, you're a senior officer, you're part of them. So the impression is that, whatever my patient is going to tell me, I will probably report it to my peers. The captain, the staff captain, the hotel director, Of course, I would never do that, but that's just the impression. But when wearing my medical scrubs, I will just see that, the crew will be so much more relaxed and they will open up so much more. And the passengers as well. I will just notice that the interaction is more like on land when I interact with my patients. It's more direct, it's more spontaneous. Because now I think that, they don't see me as a cruise ship officer. They now see me as a doctor. And so that's why I wear scrubs in the medical center most of the time. Now, because I'm the senior doctor, I'm always the senior doctor on cruise ships, I will attend a lot of meetings. And in those meetings, those formal meetings, you've got your steering committee meetings, you've got your deck meetings, your captain's meetings. There's a lot of meetings. And in those meetings, I would have to wear the uniform. And that's why you would see that in the morning, because most of these meetings will be in the morning, in fact, all of them. In the morning, I'll wear my white uniforms because I might come to the clinic at 8 o'clock, but then there's a meeting at 9 o'clock, or there's a meeting starting at 8 o'clock, or at 10 o'clock, so it depends. So I would wear my officer's uniform in the morning, and then in the afternoon, I know that there's no more meetings, I would then wear my scrubs. Now, what are the colors of the scrubs that are allowed on cruise ships? Some cruise lines will say that, obviously you have to wear the uniform as defined and detailed by the cruise line. But when it comes to the medical scrubs, you can wear whatever medical scrubs you like, whatever color you like. As long as it's proper medical scrubs, it's tidy, it's neat, no problem. And so on some cruise lines, you're allowed to have black scrubs, blue scrubs, purple scrubs. I have red scrubs, I've got purple scrubs, black, gray, a mix of gray and black, a mix of black and red, a mix of Bordeaux and black. So, it depends, As long as it's neat, no problem. And you can choose the company you prefer. Figs, you like figs, you can bring your figs on board. You like Cherokee, you can bring, I don't know if Cherokee is still around, you can bring your Cherokees on board. You like Dickers, you can bring Dickers on board. Whatever is most comfortable for you. Now, on some cruise lines, they would want you to have the medical scrubs issued by the cruise line. So everybody must have blue scrubs issued by the cruise line, and then it's part of your uniform. You can only wear those scrubs issued by the cruise line, and you're not allowed to wear your own. 2 problems with that. First of all, sometimes they would not have your size on board. You find that they only have small and large and extra large, but you medium. Or they only have large and you small. And so sometimes you're going to end up with oversized scrubs because they don't have your size, and you might wait for months for your size to come on board. And sometimes, you go home and you never had your size. Same with the pants. Sometimes you find that the pants are not your size, so it's a bit too big or too small. And, so that's problem number 1. Problem number 2 is that sometimes they don't give you enough of the scrubs they have. They might give you only 2 pairs of scrubs. 2 tops and 2 pants because they don't have more on your size, or they only issue 2, something like that. I remember when I was at Virgin, they did not have enough scrubs, and so they would recycle the scrubs, meaning, the medical team would wear their scrubs for the duration of their contract, and then when leaving, they will have to leave the scrubs. They will then re-tag them, remove the name tags at the back, and then re-tag them with the new names, and then you would use second-hand scrubs, something I categorically refused to do. And so I decided to go on Amazon and buy my own scrubs that were similar to the cruise line. But it's not ideal, right? I mean, if you want your medical personnel to wear cruise line specific scrubs that you're going to provide, then make sure that you have enough of those, Yeah. But many cruise lines, in fact, most cruise lines will allow you to wear the scrubs you want. You've got your own scrubs, you're most welcome to wear them. And I think that's the best policy. I personally love black scrubs. I feel in my element in the ER wearing black scrubs. And I think for many, it's also psychological. You find that some people, after years, I'm talking about ER personnel, ER doctors, some people have mentally, they're in their space when they wear black scrubs. Others, they're most comfortable when they wear gray scrubs. Others, blue scrubs. Others, red scrubs. So whatever scrubs you prefer, you should be free to wear them. You want to be comfortable. And if, I believe in color therapy, just like I believe in musical therapy as well. And if a particular color for you is going to brighten your day, or maybe put you in a state where you're going to be more focused, calmer, why not? Wear your blue scrubs if you like your blue scrubs. Wear your black scrubs if you like your black scrubs. Now, when I was working at Disney this year, there was a particular captain that hated black scrubs. And he told the medical team that he didn't want to see any doctor or any nurse wearing black scrubs. And that message was conveyed to me by the senior doctor I was replacing. And I thought, this is ridiculous, And one day I was wearing my black scrubs, and that particular captain saw me, and I could just see that he didn't say anything to me, but he looked a bit uneasy there. But he never said anything. And then the nurses told me that, by the way, this captain, he's got this thing about black scrubs. He doesn't want any black scrubs on the ship because he believes it's bad luck. And I thought, this is ridiculous. This is ridiculous. You're not a doctor. You don't know why doctors like wearing black scrubs. And, I had all those black scrubs. One of the nurses also had black scrubs. And I told the nurse, look, if you like your black scrubs, keep on wearing them. No issue. Just don't walk around with the black scrubs in the crew area so that, But in the medical center, you can wear your black scrubs. And if there's any complaints, then we will stop wearing them. But let people be. Unfortunately, at Disney Cruise Line. Now, if you want to hear more about cruise ship stories, please join me on Patreon, where I have lots of bonus videos that I do not post on YouTube. I also answer all questions on Patreon. You can ask me anything you want, and I will reply to you. I will give you some one-on-one advice as well. You can DM me. See you on Patreon.